Hi, I'm Jessica Thomas, Director of Patient Education for the Neuroendocrine Tumor Research Foundation. It is June, and it's time for our Thrivership series. And for this month's Thrivership series, I want to talk about something that I've talked to with a couple of NET patients recently. So I thought it would be good to bring these resources and information here. We're going to talk a little bit about anxiety during scans, prior to scans, and while you're waiting for the results. This is something that is incredibly common in a NET journey, in a cancer journey, and often in people's medical journeys. That if we're dealing with an illness that is relatively invisible, and sometimes with symptoms, sometimes without symptoms, we may not be thinking about it too much until it's time for those scans to come up, time to get imaging or MRIs, PET scans, etc. And so I want to start off by saying that this is normal to feel a sense of anxiety. The phrase is also termed Scanxiety as well. But what can we do to help us as we are facing, confronting scans coming up, as we are literally getting the scans, and as, of course, as we wait for results? So the first part. Life is going on, and then all of a sudden we realize, you know what, we have a scan coming up. And that can kind of stop us in our tracks. So ways to manage this anxiety. One is by making sure that we're taking control of the things that we can. And so that is by still getting our scans. Sometimes when we get nervous or anxious, we may not want to do something or not want to face it. But facing it is helpful because it gives us a sense of control. And then also the scans are important because they let doctors know and let you know how your disease is doing. The second thing is talking about it. It's okay to normalize, that I'm nervous, that I have a scan coming up. Giving yourself space to connect with other people that might understand what you're going through if you're connected with a support group. Even, mentioning it to your doctor is okay too. It's okay to normalize that this is an anxious time. But what are some strategies, tools that you can put into place during this time? Some distraction techniques might be good. Focusing on things that you're looking forward to. Allowing yourself to be involved in things that you're enjoying, that you feel distracted by. And even though you have the scan coming up, not letting that take the focus of everything that is going on in your world in that moment. So for the second part here, what do you do about managing anxiety during a scan? Scans, either through a PET scan or an MRI, they're can be a little bit nerve-wracking. The good thing is, sometimes we are aware of what these scans sound like, what they feel like, what the experience is going through, but sometimes that doesn't make it easier too. So I like to recommend breathing techniques as you're getting scans. Breathing techniques are something that can give you something to focus on, and it can be something that can physically relax your body during a scan. And so at the end of this Thrivership series, I'm going to introduce two different breathing techniques and walk you through them. Important if you're getting a scan and you're feeling nervous, to just tell the person that's doing the scan. They may have resources such as music. I know for many MRI imaging centers have music that you can listen to, that you can pick calming music, relaxing music. And there might be other strategies and techniques that your team that's doing the imaging can help you with. It is important that we manage those feelings of anxiety as we wait, because until images are read, we don't know what they say. And I can understand that's a challenging thing. I highly recommend to engage in activities that, again, distract you, that are relaxing, that you give yourself grace if you're feeling a little bit more anxious, a little bit more wound up. To remind yourself that that you have a healthcare team that's going to give you those results when they're ready, and to do things that help you, and the things that help you more than I know the things that help you. that will help calm you and relax you. If it's sitting outside, if it's watching the birds, if it's a phone call with friends, whatever it is that's going to help you to kind of manage that period of time. So for this next part, I'm going to walk us through some breathing activities, exercises. And the first one I'm going to share is called box breathing. This breathing can be called box breathing, square breathing, or tactical breathing. There's lots of different names, and it doesn't matter what you call it as long as you use it. You can use it during your scan in some cases, and if not, you can use it prior to going into your scan. And so for this type of breathing, what we are going to do is that we are going to breathe in. We inhale through our nose and we exhale through our mouth during this breathing. We're going to inhale for a count of 4, hold it for a count of 4, exhale for a count of 4, and then hold that for a count of 4. So we inhale for 2, 3, 4. We hold for 2, 3, 4. Exhale for 2, 3, 4, and hold for 2, 3, 4. Again, we inhale for 2, 3, 4. We hold for 2, 3, 4. We exhale for 2, 3, 4, and we hold for 2, 3, 4. There is another type of breathing exercise that I like, and I call it 1 to 2 breathing. And the reason why is that the exhale is twice as long as the inhale. And again, for this breathing exercise, we are going to inhale through our nose and we're going to exhale through our mouth. And depending on your breath capacity, you can customize this to how it works for you. But for this example, we are going to breathe in for a count of 3, and we're going to exhale for a count of 6, and then I'll do one with 4 and 8. So for this exercise, we will inhale for 2, 3, and then exhale for 2, 3, 4, 5, 6. We'll repeat with a larger number. So we will inhale for 2, 3, 4, and then exhale for 2, 3, 4, 5, 6, 7, 8. This is something that can be very helpful for you to help just lower your blood pressure, give you a sense of relax, and to immediately feel a little bit less anxious. I encourage you to try both of those breathing patterns. Last thing I'm going to share is a micro relaxation technique. And micro relaxation techniques, I think, can be extremely beneficial because we don't have to wait till we have a lot of space and time, and they can be done anywhere, and they can be done quickly. And I think when we're feeling a sense of anxiety, either before a scan, during a scan, that these little moments you might be able to take to help calm. So for this example, this micro activity, I want you to take one hand and put it over your heart. And then I want you to take your other hand and put it over your stomach. And I want you to breathe in for a count of 3 through your nose, and then out for a count of 3 through your mouth. So breathing in for a count of 3, and then out for a count of 3. We'll repeat the breathing one more time. In through a count of 3, and out for a count of 3. And in this moment, I want you to think of a thought, of a statement that is helpful for you, something that you need to hear. Maybe it's, I can do hard things. It could be, I am thinking healthy thoughts. My body is not perfect, but I am taking care of myself. I'm giving myself the love and grace that I need right now. Whatever statements it is that you need to hear during that time. So I hope between the breathing and the micro practice of relaxation, that one of these tools could be helpful for you. If you experience anxiety and you are not able to manage it, or you're having trouble with the tools to use, please feel free to reach out.